Hello, my name is Holman-Allgood, and today I'll be talking about breast cancer screening alternatives in low-resource settings seen around the globe to be applied within the Caribbean, a narrative review. Breast cancer is one of the leading causes of death in women worldwide. In 2018, it was shown that out of all cancers, the estimated number of new cases of breast cancer within women was 24.2%. Specifically, in low-resource regions, women are dying more and more due to late diagnosis and severity of disease at the point of diagnosis. Much of this is due to the lack of resources in these areas to screen women. Women in the Caribbean are no exception. Breast cancer is the leading cause of death for women in the Caribbean, accounting for 14 to 30% of all deaths. The average age of diagnosis in the Caribbean is 65 to 74 years of age. The gold standard, the mammogram. The mammogram is the gold standard for women 40 and over. But to be honest, the mammogram is not feasible for everybody, and it's not accessible for everybody. Specifically in the Caribbean and the rural regions, these women don't have access to a mammogram machine. They'll never see a mammogram machine in their life, some of them. It's not feasible for them to always go to the clinic every year to get a screening for breast cancer. Some of these women, if diagnosed and if needing a mammogram because they've found a lump in their breast, some of them have to travel to another country within the Caribbean just to receive care. And this is not always an option for these women as well, specifically in the rural, low-resource setting regions in the Caribbean. The purpose of this literature review is to explore alternative methods being developed or used in various low to middle income countries so that an understanding of what was successful and what challenges were faced within these programs and these initiatives and these campaigns. And by evaluating the literature, we can potentially implement a program within the Caribbean for an alternative for these women who are not able to afford a mammogram or not able to get to a clinic all the time. So in this review, initially over 500 articles were found when searching for alternative methods for breast cancer screening. It wasn't just specifically for the Caribbean because we wanted to see what was out there. I wanted to see what other countries were doing, what was successful, what failed, and what challenges were seen from other studies. From those over 500 articles, 46 articles were picked after screening of the title and abstract. Of those 46 articles, an in-depth evaluation was taken for all 46 articles, and 12 were included in the final paper. Of those 12, many different programs, campaigns, and educational initiatives were implemented. The programs that were implemented showed that providing a clinical breast exam instead of a mammogram for women for screening was more feasible, which is true. Some of the other programs that were established was teaching community health workers and nurses how to do clinical breast exams and breast self-exams, and how by teaching them so that they could teach the women self-breast exams as well as give the women clinical breast exams, how did that help the rates mortality and incidence within these countries? Another campaign was a mobile mammogram unit. This paper was included because even though they used the standard of care, they were bringing down one of the biggest barriers within, which is access. So a mobile unit was taken into rural regions with mammograms, and they screened over 1,000 women. So this program was actually successful, but it showed some challenges and it showed some limitations. And those limitations were, once the women were screened and if there was some abnormalities found, the follow-up was low. So that's a challenge that was seen. And follow-up after a lot of these programs was a big challenge and a big barrier to the next step. So the women were being screened, but they weren't being followed up with. Another one of the articles talked about a mass media campaign. And the mass media campaign was basically their goal, and this campaign was a 5-week campaign for breast cancer. And their goal was to change the mindsets of the people, to encourage them, to make them knowledgeable, to make them want to seek care. Another one of the articles showed that by doing mobile phone calls and increasing knowledge that way, it was better. But the limitations in this article is that not everybody, especially in low to middle income countries, have access to a phone. So that would be a challenge if this was implemented. Another article, they really valued education, and not specifically education women over 40, but educating teenage participants. And by educating teenage participants, they wanted to show that starting the education process early in terms of breast cancer, then those women would be empowered to know more about their bodies, to seek care, and to understand the complications and the consequences of not seeking care and not being screened. A lot of these articles, like mentioned previously, had some limitations, some challenges, but some success stories as well. The screening did go up for those brief periods of time. So it could be said that if this program was implemented into the Caribbean, it could potentially be successful. In conclusion, by reviewing all 12 of these articles, I believe that a good program to be implemented in the Caribbean and using these articles as the foundation means that the program would need to be educational, as well as teaching the health workers within that community. By teaching health workers within your community, as one of the articles stated, those health workers know the community. They know the myths, they know the disbeliefs, they know why women don't come in, or why people don't come into the clinic, or the barriers that they face. So by teaching them about breast cancer, they are the best advocates to go out, to send out into the community, to increase the education about surrounding breast cancer, and to encourage people to come in to be screened. And a good screening tool, which we could also teach these health workers, is portable ultrasound, or in conjunction with the clinical breast exam and the self-breast exam. So I believe by making a multi-focal project or program is going to be the most successful and sustainable program that could be implemented into the Caribbean. Thank you.